Many seniors believe that sleep position is merely a matter of comfort or habit, but groundbreaking evidence in geriatric health is revealing that something as simple as turning onto your left side before falling asleep can radically alter the trajectory of your well-being after age 60 and potentially add years to your life. As we age, our bodies undergo a cascade of physiological changes that influence how we sleep, how our organs function during rest, and how our bodies respond to chronic conditions such as high blood pressure, acid reflux, sleep apnea, heart disease, and even lymphatic drainage inefficiencies. It turns out that the left side of the body is uniquely suited for better overnight organ function, and sleep experts are now urging older adults to stop sleeping on their back or right side and adopt the left side posture as a nightly habit. For instance, when you sleep on your left side, gravity helps improve the efficiency of your digestive system by allowing food waste and stomach acids to travel more freely from the stomach into the intestines without backing up into the esophagus. This is particularly vital for seniors who suffer from acid reflux or GERD, which can cause chronic inflammation of the throat, esophagus, and lungs during sleep. Lying on your left side takes advantage of the natural curve and orientation of the stomach, reducing nighttime acid exposure and improving overall digestive comfort, which in turn reduces nighttime waking and improves sleep quality. But digestion is just the beginning. Cardiology research has shown that the position in which we sleep directly affects heart health, particularly in older adults. Since the heart is positioned slightly to the left in the chest, sleeping on your left side reduces pressure on the heart, encourages better blood flow, and assists in relieving the workload on the cardiovascular system. This is especially crucial for people over 60 who are more vulnerable to heart failure or arrhythmias. When lying on your right side or back, the weight of the body can press against the large blood vessels like the aorta and vena cava, disrupting circulation and making the heart work harder throughout the night. A study involving heart failure patients showed significant improvement in symptoms and quality of sleep simply by switching to a left side sleeping position. Moreover, sleeping on the left side facilitates better lymphatic drainage, which is essential for removing toxins, cellular waste, and inflammatory byproducts from the body. The lymphatic system relies on gravity and body posture to operate effectively, and since the majority of the lymphatic system drains into the thoracic duct located on the left side, sleeping on your left side allows lymph fluid to flow more freely and clear waste more efficiently. This not only helps your immune system stay strong, but also reduces systemic inflammation, a major contributor to chronic diseases like arthritis, diabetes, and even Alzheimer's. In addition, your spleen, a vital organ in the lymphatic and immune system, is also located on the left side of the body. When you lie on your left side, you promote better filtering of the blood through the spleen and allow this crucial organ to perform its detoxification role more efficiently while you sleep. But the benefits of left side sleeping don't end with digestion, heart health, and lymphatic drainage. For seniors who experience snoring, mild sleep apnea, or shallow breathing during sleep, the left side position can reduce airway compression, improve lung expansion, and facilitate more rhythmic breathing. The anatomy of the lungs and bronchi allows for smoother airflow when lying on the left side. And for those who suffer from chronic bronchitis, asthma, or congestive pulmonary complications, this seemingly small change can dramatically reduce nighttime coughing, congestion, and awakenings due to breathlessness. It also lowers the risk of micro-awakenings that compromise sleep architecture, leading to more restorative rest. On top of that, this posture has been linked to reduced swelling in the lower extremities. Seniors often struggle with edema, especially in the legs, due to poor circulation and weakened veins. Sleeping on the left side improves venous return to the heart and reduces pooling of blood in the feet and ankles, which not only helps with swelling, but also decreases the risk of blood clots or deep vein thrombosis, both of which become more common with age and sedentary lifestyle. In women, particularly postmenopausal women, who are more prone to varicose veins, or pelvic congestion syndrome. This positioning has also been observed to reduce discomfort and vascular pressure in the pelvic region. And for those worried about liver function or gallbladder health, left-side sleeping allows for freer bile flow, enhanced liver detoxification, and better drainage of waste from the liver into the digestive tract. These benefits work synergistically to support healthy metabolism, liver enzyme balance, and blood sugar regulation, factors that play an enormous role in reducing age-related fatigue and preventing insulin resistance. What's even more astonishing is how something as basic as sleep posture can influence cognitive health. Emerging studies in neurology have discovered that left-side sleeping can assist in the removal of beta-amyloid plaque from the brain, a key marker in Alzheimer's disease. This clearance is facilitated through the glymphatic system, a brain-wide network that clears waste during deep sleep. Because this waste drainage system is dependent on cerebrospinal fluid dynamics and gravity, sleep position directly influences how effectively your brain detoxifies itself each night. Left-side sleeping, researchers suggest, optimizes these dynamics and may delay or reduce the risk of neurodegenerative diseases by maximizing nightly brain cleansing. This insight could be life-changing for seniors hoping to maintain mental sharpness, memory, and clarity well into their 80s and 90s. Add to this the increased comfort and decreased musculoskeletal strain experienced by those with chronic pain, and the case for sleeping on your left side becomes even stronger. Seniors often suffer from back pain, hip discomfort, or joint stiffness that makes sleep elusive and fragmented. However, with the correct mattress and pillow support, left-side sleeping can align the spine, reduce pressure on joints, and ease tension in the lower back and neck, areas commonly aggravated by back or right-side sleeping positions. The cumulative effect is better posture, improved energy upon waking, and fewer aches that sabotage daily mobility and independence. The compelling health advantages of sleeping on your left side after 60 become even more profound when you consider how it influences hormonal balance, gut-brain communication, and endocrine function in aging adults, which are all subtle yet powerful contributors to how you feel, function, and fend off chronic disease every day. During sleep, your body works hard to reset hormonal rhythms, especially those connected to melatonin, cortisol, insulin, and leptin. Melatonin, the sleep hormone, is not only essential for helping you fall asleep, but is also a potent antioxidant that supports immune function and helps protect your brain against oxidative damage. When sleep quality is disturbed by improper positioning, especially from snoring, acid reflux, or poor circulation, melatonin production can be suppressed, throwing off your entire circadian rhythm. Sleeping on your left side creates the least physical disruption to sleep cycles and helps preserve the nocturnal release of melatonin and its healing benefits. Meanwhile, cortisol, your body's stress hormone, naturally peaks in the early morning to help you wake up. However, in seniors who experience poor sleep due to disrupted breathing or indigestion, cortisol levels can spike prematurely, waking them around 3 or 4 a.m. and contributing to that wired but tired feeling. By adopting a consistent left-side sleeping position, seniors can minimize those overnight stress signals, encouraging deeper, more restorative sleep cycles and waking up with less anxiety, less confusion, and more mental clarity. Furthermore, when your digestion improves overnight due to better gastric and bile flow, as it does when sleeping on the left side, it sends a cascade of signals to your brain through the gut-brain axis that reduce inflammation, stabilize mood, and improve cognitive processing the next day. This is especially important for older adults, as the gut produces over 90% of the body's serotonin, a neurotransmitter essential for mood regulation, appetite control, and even motor function. A sluggish or overburdened digestive system at night can trigger stress signals and inflammation that disrupt this delicate serotonin balance, leading to irritability, poor focus, and increased sensitivity to pain. Conversely, optimal left side sleeping promotes a calmer gut, a clearer mind, and a more balanced emotional state the next day. Additionally, blood sugar regulation is also enhanced when sleep is undisturbed, and sleeping on your left side can play an important role in this. Seniors with diabetes or prediabetes often experience nighttime glucose spikes due to liver activity and hormonal fluctuations. Because the pancreas is positioned more toward the left side of the abdomen, sleeping on that side facilitates improved insulin secretion and glucose clearance. This leads to more stable overnight blood sugar levels and reduces the risk of morning insulin resistance, grogginess, or the all-too-common brain fog that plagues many older adults. But the vascular benefits of this sleep position continue to shine, especially in women. Postmenopausal women are at greater risk for cardiovascular events, and the way the body lies during sleep can either support or hinder blood flow to the heart and brain. Left side sleeping promotes venous return to the heart, easing the workload on the circulatory system, and reduces compression on the inferior vena cava, which can become partially blocked when sleeping on the right side. This is a simple yet highly effective way to reduce cardiovascular strain during the hours when your body is supposed to be recovering. In fact, some cardiac patients are now being advised by their physicians to avoid sleeping on their right side entirely due to the risk of reduced cardiac output during the night. Moreover, kidney function is subtly enhanced when lying on your left side, particularly during the nocturnal hours when your body filters waste from the blood. With gravity aiding lymph and venous flow, your kidneys are under less pressure and can more effectively produce and regulate urine. This may reduce the frequency of nighttime urination that plagues many seniors and disrupts deep sleep. As the kidneys perform their overnight detoxification, being in a left side position allows better clearance of byproducts through the ureters, reducing back pressure and supporting more efficient elimination. Combined with an evening hydration routine and mineral balance, this sleep posture can minimize nocturia, the frequent waking to urinate, and give seniors the uninterrupted sleep their brains and bodies desperately need. On the topic of brain health, the glymphatic system's activity during sleep, which is how your brain washes itself, is maximized when spinal alignment and cerebrospinal fluid flow are optimal, and this is best achieved when lying on your side, particularly the left. Studies using MRI scans have shown that fluid clearance from a brain is more efficient in lateral positions, and this is vital in preventing the accumulation of toxic proteins linked to Alzheimer's disease and dementia. Given that these neurodegenerative disorders often begin silently, years before symptoms arise, consistent left-side sleeping could be a non-invasive, cost-free way to slow or prevent cognitive decline. Even issues like dry mouth, dental grinding, and jaw tension, common in older adults, can be indirectly improved by this posture. Left-side sleeping encourages more even distribution of oral pressure and less tension in the jaw joint. Some dentists have found that side-sleeping seniors experience fewer cases of nighttime bruxism, teeth grinding, and less temporomandibular joint discomfort compared to those who sleep on their back. By relaxing the head and jaw muscles in a more natural position, seniors wake up with fewer oral or facial aches. In terms of respiratory health, the mechanics of breathing are subtly altered based on posture, and the left side sleep position has been shown to improve lung ventilation and perfusion balance. For those with mild sleep apnea or age-related lung capacity decline, this can mean fewer apnea episodes, reduced snoring, and better oxygen saturation levels throughout the night, which helps preserve brain function and energy. Oxygen deprivation at night has been linked to accelerated aging, cardiovascular damage, and impaired memory in seniors. So improving oxygen uptake with something as simple as posture is a major win. And while all these internal benefits accumulate night after night, perhaps the most visible transformation happens in the area of energy and vitality. Seniors who switch to sleeping on their left side frequently report improved mood, fewer body aches, reduced morning grogginess, and even enhanced mobility because the restorative quality of their sleep improves so significantly. Without even realizing it, seniors begin to reclaim the deep, healing rest that their bodies have been missing for years, simply by turning onto their side and sticking with it consistently. The compounding effect of better digestion, smoother breathing, healthier circulation, improved detoxification, and balanced hormones is what turns a small habit into a major health shift. In the world of aging, every advantage matters. When we take a closer look at how posture during sleep affects the aging spine, muscles, joints, and nervous system, it becomes even clearer that sleeping on your left side after 60 is far more than just a comfortable position. It's a biomechanical strategy that supports longevity, reduces pain, and enhances mobility without requiring medication or physical therapy. For older adults, spinal alignment becomes increasingly crucial due to the natural loss of disc height, muscle elasticity, and joint lubrication. Sleeping flat on the back often creates exaggerated lumbar curvature and increases pressure on the lower back, particularly in seniors who have degenerative disc disease or arthritis. On the contrary, lying on the left side with a pillow between the knees helps straighten the spine, opens up the hips, and distributes body weight more evenly, reducing nerve impingement and allowing the vertebrae to decompress naturally during the night. This improved alignment also benefits the cervical spine, reducing the likelihood of neck stiffness, tension headaches, and radiating pain in the shoulders and arms. Many seniors report waking up with tingling or numbness in the extremities, unaware that this can stem from poor sleeping posture compressing nerves overnight. By sleeping on the left side with appropriate support under the head and between the knees, nerve pathways remain more open, circulation improves, and the central nervous system is allowed to rest and reset without interference. Furthermore, this position also enhances lymphatic drainage, especially for the upper thorax and head. The lymph system is a critical but often overlooked part of immune health, and it relies entirely on body movement and gravity to circulate lymph fluid and eliminate waste. Since the left side of the body is the dominant drainage route for lymphatic flow, lying on that side assists the body's overnight detoxification processes. This has major implications for inflammation, which is a root contributor to almost every chronic disease that disproportionately affects seniors, including heart disease, type 2 diabetes, osteoarthritis, and even certain cancers. Left side sleeping supports the flow of lymph through the thoracic duct, easing the burden on the immune system and helping flush toxins from the brain, digestive organs, and extremities. This is particularly helpful for seniors experiencing chronic swelling, water retention, or recurring infections. At the same time, this sleeping position reduces intra-abdominal pressure, which benefits seniors with hernias, acid reflux, or even slow digestion. When lying on the right side, the angle of the stomach and esophagus allows acidic stomach contents to flow more easily into the throat, often causing painful reflux episodes that disrupt sleep and increase the risk of esophageal damage over time. Left side sleeping, however, positions the stomach lower than the esophagus and reduces the chance of acid escape, providing natural relief for gastroesophageal reflux disease, GERD, a condition that plagues many seniors and is often treated with medications that carry dangerous side effects when taken long-term. This gentle correction in posture can drastically reduce nighttime coughing, hoarseness, and the bitter taste in the mouth that so many older adults wake up with. Moreover, left side sleeping can improve nighttime metabolism by enhancing bile flow from the liver and gallbladder. This supports fat digestion, cholesterol regulation, and hormonal waste processing, all of which are essential in seniors who experience metabolic slowdown and age-related weight gain. A better functioning liver at night means a cleaner bloodstream by morning, which translates to clearer skin, improved concentration, and a reduction in joint inflammation. This seemingly small change of posture becomes a catalyst for metabolic efficiency, immune clarity, and energy restoration in a body that's more sensitive to imbalances than it used to be. Even for those managing chronic diseases like high blood pressure, sleeping on the left side has shown to offer specific benefits. Some studies suggest that lying on the left side reduces pressure on the heart and improves circulation back to the heart, which can lower systolic blood pressure during sleep. Since high blood pressure often goes unnoticed at night, this natural postural correction may reduce the need for additional medication and support better cardiovascular stability. Seniors who snore or suffer from mild to moderate sleep apnea can also experience improvement from this position, as it reduces the likelihood of airway collapse that is more common when lying on the back. The weight of the tongue and soft tissues in the throat naturally falls backward when lying supine, increasing the risk of airway obstruction. Sleeping on the left side keeps these tissues from collapsing into the throat and allows for more consistent airflow, which leads to better oxygen saturation levels and less strain on the heart and lungs. Sleep apnea, if untreated, is directly linked to cognitive decline, heart disease, and metabolic syndrome, all of which can be subtly reduced by simply turning to the left at bedtime. Perhaps what makes this shift so powerful is its accessibility. There's no pill, no expensive treatment, no therapist or surgery involved. It's a habit seniors can adopt immediately, even tonight, and begin reaping the benefits in just days. The simplicity of it makes it almost unbelievable, yet the science confirms again and again that how we sleep, both in duration and position, profoundly affects aging. A supportive mattress, a firm yet soft pillow, and the strategic placement of a cushion between the knees can turn this advice into a daily practice that transforms the quality of sleep and therefore the quality of life. And what's even more fascinating is how quickly the body responds to better positioning. Within a week of consistent left side sleeping, many seniors report fewer nighttime awakenings, improved digestion, lighter legs in the morning, fewer cramps, and even reduced puffiness in the face and ankles. These are the visible and felt signs that the body is finally getting the circulation, drainage, and support it has been missing. As your body relaxes into its optimal shape during sleep, it uses that time not only to rest, but to repair, rebuild, and regenerate, something that becomes harder and slower with age unless conditions are ideal. Left side sleeping makes those ideal conditions possible again, without needing to reverse the clock or defy biology. It simply works with your body's natural anatomy and physiology to reduce stress, restore balance, and promote healing where it's needed most. What often surprises both seniors and medical professionals alike is just how many ailments commonly accepted as part of aging can be mitigated or even reversed by something as simple as adjusting sleep posture. The left side position isn't just ideal for digestion or heart health. It also affects the brain's ability to clear out toxins, a process known as the glymphatic system, which is increasingly being recognized as vital to preventing neurodegenerative conditions like Alzheimer's disease and other forms of dementia. This clearance mechanism is most active during deep sleep and appears to work more effectively when a person lies on their left side, facilitating cerebrospinal fluid flow through the brain's waste removal channels. For seniors worried about memory loss, brain fog, or declining cognitive function, this single habit may support mental clarity in ways that no supplement or crossword puzzle ever could. Furthermore, when older adults sleep on their backs, the tongue and soft palate can fall backward, narrowing the airway and potentially worsening undiagnosed sleep apnea, a condition highly prevalent but underdiagnosed in the senior population. The cumulative effect of poor oxygenation over time is linked not only to cardiovascular events, but also to microstrokes, which often go unnoticed yet contribute to gradual mental decline. Left side sleeping reduces the risk of such airway obstructions, helping ensure the brain receives adequate oxygen throughout the night, thereby preserving both cognitive function and emotional stability. Emotional regulation, too, is often improved with better sleep positioning, as uninterrupted rest allows the amygdala and prefrontal cortex to better process stress, grief, and anxiety. Emotions many seniors silently carry as they adjust to retirement, the loss of loved ones, or major life changes. And for women over 60, who may experience sleep disturbances due to postmenopausal hormonal fluctuations, the left side position can relieve pressure on the liver and enhance estrogen metabolism, which plays a subtle but meaningful role in stabilizing mood, weight, and inflammation. The compounding benefits extend to joint and muscle recovery as well. Seniors living with arthritis, fibromyalgia, or age-related muscular tightness often find that the left side position reduces overnight stiffness, improves morning mobility, and allows their bodies to relax into deeper stages of non-REM sleep, where tissue repair and hormonal balancing occur most effectively. Additionally, improved lymphatic drainage through the thoracic duct during left side sleeping reduces systemic inflammation, which in turn alleviates morning swelling in joints, ankles, and hands, a common and frustrating complaint among older adults. What's especially empowering is that this technique requires no special equipment beyond a supportive pillow and a commitment to consistency. For those with existing conditions such as shoulder pain or hip bursitis, it's important to use body positioning aids like memory foam wedges or full-length body pillows to customize the angle and pressure distribution. With time, even chronic side sleepers who prefer the right side can gradually retrain their bodies through behavioral cues, such as placing a tennis ball in the pocket of a pajama shirt on the right side, or propping up the bed slightly on the left to encourage natural gravitation into the desired position. These small, intentional adjustments work remarkably well when integrated into a bedtime routine, and over the course of weeks or months, they become automatic, making healthy left side sleeping a default behavior rather than a nightly struggle. What's equally remarkable is how quickly seniors begin noticing improvements, not just in the way they sleep, but in how they feel during the day. Deeper, more restorative sleep leads to more stable energy levels, reduced dependency on caffeine or naps, and improved immune resilience, which is critical during cold and flu seasons and even more so during global health threats. Sleep itself becomes not just a passive activity, but an active investment in well-being, disease prevention, and long-term independence. For caregivers and adult children supporting aging parents, encouraging this change can be as simple as gifting a supportive side-sleeping pillow or creating a cozy nighttime routine that makes left side positioning the path of least resistance. Conversations around medication, diet, or exercise can feel overwhelming, but repositioning how one sleeps is a soft, non-threatening entry point into broader health conversations that empower seniors to take charge of their well-being without needing to overhaul their lives. Left side sleeping also supports better bowel movement patterns, something many seniors struggle with silently. By aiding gravity-assisted transit of waste through the colon, this position helps reduce constipation, bloating, and even the need for laxatives, which can disrupt electrolyte balance when overused. Regular, complete bowel movements contribute not only to digestive comfort, but to better absorption of nutrients from food, making each meal more impactful. In the bigger picture, these internal benefits shape the external quality of life. Seniors who sleep well and digest efficiently tend to engage more confidently in social activities, maintain steadier moods, and exhibit greater mental agility. Their skin looks brighter, their eyes clearer, and their posture more upright. They walk more steadily, feel fewer dizzy spells, and retain a greater sense of vitality that younger family members often find inspiring. So while sleeping on the left side might seem like a niche piece of advice, its ripple effects touch every corner of physical, mental, and emotional health, especially for those over 60. It's not an exaggeration to say that this small nightly habit could be the hidden secret behind why some seniors age gracefully, avoiding the pitfalls of chronic illness, emotional burnout, and physical deterioration. The body knows how to heal itself. It just needs the right conditions. And sometimes That begins not with a doctor's appointment or a new prescription, but with a quiet shift in how you settle in a bed tonight. Seniors who adopt this habit consistently report fewer doctor visits, reduced medication dependency, and greater satisfaction with their overall quality of life. As we age, health isn't built in grand gestures, but in quiet routines repeated consistently. And sleeping on the left side may be the most underestimated, powerful health move of all.